Hello, I'm Ushma Neal with the Journal of Clinical Investigation series, Conversations with Giants in Medicine. On any given day, over 50 billion of the cells in your body will die. Most are replaced, and the question of how we live while our cells are continuously dying has captivated today's interview subject, Dr. Vishva Dixit. After a long career in academia, Dixit has risen through the ranks at Genentech and currently serves as the Vice President for Early Discovery Research. His scientific work has elucidated many of the mechanisms of apoptosis, including the discovery of caspases. He's more recently focused on the inflammatory pathways in disease. Thank you so much for joining us today, Vishva.
Thank you. It's a real pleasure, Ushma. I should say I'm a big fan of the series. I think it really brings the lives of biomedical scientists to life. So thank you for having me.
Well, I'm delighted you're here. Do you think you could start by telling me a little bit about your parents and what you were like as a child?
Yeah, so I've had a very unusual trajectory. Unlike a lot of your guests, I didn't go to a famous medical school or have a famous mentor. I was born and brought up in Africa, in Kenya. My parents of Indian origin, they were drafted into the British colonial service. They were both physicians, and this was in the 1940s, and they worked in the Northern Frontier District. This is the part of northern Kenya that abuts Somalia. It's where the Sahara Desert is, and there were prisoner of war camps there and nomadic tribes. And my father said it was characterized by the 5 S's: sun, sand, scorpions, snakes, and shifters, who were the local bandits. But after the war, the camps disbanded, and they decided to make a go of it in Kenya. They moved to the highlands in Kenya and spent much of their life in Kericho, where the tea estates are. This is about 7,000 or 8,000 feet above sea level. So even though it's very close to the equator, the weather is extremely temperate. And I was born in 56 and grew up. Now you have to realize this was a time when Kenya was a colony. We had a very strict, really apartheid system. So blacks, browns, and whites were kept apart in terms of schools, in terms of hospitals. And also at this time, there was the turbulent Mau Mau rebellion in Kenya because the local population was seeking independence. So it was a turbulent time, but independence was achieved in 1963. And then things rapidly changed. There was integration of schools. Of course, my parents were anxious to send me to what was previously the European school. And with that came the sort of the trauma of integration, and as often happens. I would say I was a fairly withdrawn child, a happy child, but a withdrawn child because I had congenital keratoconus, so I really couldn't see well. So in the end, later in life, I required corneal grafts to correct that. But as a child, I really couldn't participate in sports. So I found my joy in books. I read like a fiend. My parents were very busy. I mean, when I think about it, they only took Sunday afternoons off. They worked during the day in the clinic, and then in the evenings, they would go for their calls, where they would go and see the various families. So they wouldn't get home till night. And I was really taken care of by Frances, our housekeeper. And my outlet was reading. And so I love to read about explorers, about inventions, about, the unknown. So that's what kept me going.
So I read that you have an older brother and older sister who are also physicians, along with parents that are physicians. And I personally know the Indian familial piety that requires us to move into biomedicine. So were you encouraged from a young age to go to medical school, or what was your path towards ending up at the University of Nairobi Medical School?
Well, it was a bit of both. I think you're right. My parents were physicians, and my grandfather was in fact a physician. He qualified from Calcutta University in 1880s, and so there was a sense that doing medicine was a noble profession. But I think, in all honesty, what happened after independence in Africa was this is the so-called winds of change that Harold Macmillan talked about in 1960. They were actually turbulent winds of change that I think will haunt the continent for many generations to come, because the way the colonial powers had divvied up Africa, basically artificial boundaries, and the way that they'd consolidated power by amplifying tribalism led to a lot of instability. And there was a sense in the Indian community in East Africa after Idi Amin came to power in Uganda and throughout all the Indians, that maybe for the next generation, they need other options. Right. We'd always assumed we'd stay on in Africa. That was our home. But when these instabilities happened in the political environment, there was the sense that maybe the next generation needs other options. And given that, medicine became an attractive option because, it was felt a career that had could provide. And there was a certain safety net, a certain acceptance. So I was sort of reluctant to contemplate medicine. But my brother, who's been a big influence in my life, older brother, Roger, he took me to the hospital and sort of introduced me to medicine as a science and, the need for the scientific approach in medicine. It was very impressionable. He took me to the wards of pediatric oncology and say, most of these kids won't be here in a year's time because they'll be gone. And that was, of course, very, impressionable. So I think I gradually convinced myself and was convinced that medicine would be something that I could do. But I decided that if I was to do medicine, I really wanted to be an explorer. I always had this thought from my childhood that life's all about exploring and new knowledge, and the joy that explorers must have gotten, whether it was opening up Tutankhamun's tomb or finding a new land or being able to decipher the Rosetta Stone, whatever it was, that must have been such a thrill and, in a sense, a route to immortality. So I thought I would go to medical school, but I would think about a career in medical research where I could discover new knowledge.
That's interesting to hear that you say, even as you were going into medical school, you always had research in your mind. So as you went through, did you get any chances to do research while you were at medical school?
I did. I was very fortunate to come under the influence of Professor Hitiarachi, who was a professor of physiology at the university. And he had emphasized, and his classes had really impressed me, he'd emphasized, constancy of the internal environments of Claude Bernard's teachings about how systems attempt to maintain the status quo, that I could acutely take a liter of blood from somebody, yet their blood pressure would be unaltered because there'd be vasoconstriction and accelerated heart rate. And that these compensatory mechanisms, obvious at a macro level, also operated at a micro level. The fact that our genotypes were sculpted through geologic time by environmental influences, and we were a product of that. I think what he really emphasized to me was that to learn complex systems, you have to break them down and make them simple. And if you can't do that, then you've not understood the subject matter. And for me, that was a revelation, because prior to that, I was more prone to rote learning. But he tossed that out the window and he said, break it down to first principles. So I did some work with him. We did a project where we looked at electroencephalograms of children who were either in a rural environment or in an urban environment, and it come down with subacute sclerosing panencephalitis to see if there was a correlation between where they lived and that state. So it was sort of more epidemiological work, but he made me think about physiological systems. We also wrote a couple of letters to this journal Medical Hypothesis about nephrotic syndrome and vitamin C deficiency and scurvy, and it just sort of he encouraged that sort of thinking, and that was important. So he was a very important influence. And then when we went into public health, we had a very strong public health department. And that got me thinking. I was very attracted by public health, and we had to do a project where we were taken to a village with really no running water, electricity. We had to live there, and we had to, see what it was like for most of the world to live in this environment. And we had to do a research project on, in my particular case, my research project was on the pathogen burden that people carry in these environments. It could be just by doing a blood smear and a stool specimen, you could look for malaria parasites and intestinal parasites. And what struck me, one is that the vast majority of the population was highly anemic, complete. And then they had a huge burden of pathogens that they lived with. They worked hard on the farms with. That struck me. But during this time of public health, I got quite interested in it. And, at that time in Kenya, we had an infant mortality rate of 120 per 1,000. So that's out of 1,000 births, 120 won't see their first birthday. And this got me thinking that if I was a doctor, a physician, what can one do about this? And it was a very radical public health group department. And they would say, well, the health budget for Kenya at that time is a couple of dollars per person per year. And what can we do? We can open up a fancy hospital that we are building, and we're thinking of having a dialysis unit. Or we could invest it in clean water and vaccines, right? What would have more impact?
So it's so interesting to hear you talk about this, because I could have envisioned like a political career for you where you would have had an equivalently massive impact. But your next step then was to come to the US for residency. Now, how did that come about from the wilds of Kenya to then ending in St. Louis at Washington University?
Yeah, it's quite a story. And again, I have to credit my brother, and I have to say that, luck plays such a big part in this, right? I was really at an unknown medical school in the middle of Africa. And I got a break. I got a residency in pathology at WashU. And the reason for that was my brother was somehow managed to get an internal medicine residency at Barnes Hospital at WashU. And he impressed them, and he said to me, you should think about coming here. I was thinking maybe I'd go to the UK and do a PhD. And he said, well, there is a pathology program here, which is exceptionally enlightened, is they allow their residents to do research. And I said, well, but there's no formal training. I need to get a PhD. I really don't know. He said, listen, there's this lot of American researchers, many of them are part of the yellow beret, who dodged the NIH draft by going into the lab, have actually become very famous researchers. They didn't get a PhD. So there is a route for you. You don't have to, you could get a PhD. You don't have to get a PhD. You could come here and do a residency. And well, the next problem was getting a position. And of course, he convinced the director of the program to give me an opportunity to come to WashU. And it was another world, right? I mean, I was just incredibly struck by the affluence of the place. I mean, the hospital was carpeted. You had patient rooms where I worked. There were days we had 2 patients to a bed and a patient in between. And it was just like I traveled to another planet. But I started my residency in pathology and availed of this opportunity to do research.
So tell us a little bit about your work with William Frazier and how that ended up in thrombosis and thrombospondin in particular.
I have to say, I was exceptionally naive, and that even may be an exaggeration. I really was clueless. So the department said, go ahead and do research. And then they said, well, hold on, you haven't done any research, have you, Vishva? So nobody's going to want you. But look, what we'll do is we'll pay for your stipend. So you're a free body to anybody who wants you. And I interviewed with a lot of people, and Bill Frazier, he was an associate professor in biochemistry. I liked him. He was working on Dictyostelium discoideum. This is slime mold and how they adhere to each other. And he said to me, he says, hey, platelets aren't that different. Don't they stick to each other? I said, yeah, they do. He said, let's start working on that. I said, really? I said, but Bill, I haven't done any work. He says, well, have you used a pipettement? I said, no, I haven't even seen one. He said, what about a pH meter? I said, no, I haven't seen one. I've used litmus paper, but not a pH meter. He said, okay, no worries. I work in the lab. You just work with me. And when I think back on that, that was so unusual, right? I mean, imagine that happening today. If somebody came to me and said, I'd be like, get out of here, right? And so I became his apprentice. I was basically tied to his head. He showed me how to make a buffer, showed me the magic of a magnetic stirrer, showed me how to pour a gel. And he just sort of instilled a fearlessness in me, which I think back now, he didn't know about platelets. I knew a bit about platelets, but he said they adhere together and we've got the tools of biochemistry. And we had a collaborator, Sam Santoro, in pathology who knew a lot about platelets. So we had some source of wisdom. Let's just start working on it. And so this was very refreshing, right? I mean, it was like we were going into the unknown. We were flying by the seat of our pants. There wasn't really a firm game plan. There wasn't a blueprint that we were following. We were just going to see what happens, what made platelets adhere. Now, obviously, there was a lot of work on platelet adhesion at that time, but we were particularly interested in this molecule thrombospondin. It had been, in fact, identified by Phil Majerus at WashU many years ago, and the alpha granule contained a lot of thrombospondin, and Bill was interested in lectins, and lectins could be adhesion molecules. He thought maybe thrombospondin in platelets is an adhesion molecule. And we decided to sort of venture into this. But the other thing that struck me, I was in the biochemistry department at WashU, which was, very well-known department, but the journal clubs and the research in progress meetings, they were almost pugilistic matches, the sort of intellectual boxing. They would rip papers apart. They would question each other's work. And so then I realized, boy, this is sort of fun. When you get to the sort of bleeding edge, everything is a bit unknown, up for grabs. And and you can really, it's just sort of fun. So I enjoyed that environment and that atmosphere. But I started working on thrombospondin. We made a lot of progress on it, published a few papers on thrombospondin, showed it was, in fact, an adhesion molecule for platelet adhesion. So that went quite well.
So you used that foundation to then transition into a faculty job at the University of Michigan in Ann Arbor, where you founded your lab on hemostasis, thrombosis, and thrombospondin. So tell us a little bit about how you ended up there and what those early years as an independent faculty member were like.
I was recruited to the Department of Pathology by Peter Ward, and again, a very enlightened chairman. And he said to me, he knew my heart wasn't in clinical work, and he said, if you can bring most of your salary support from NIH grants, you can spend your time in the lab. I'm like, wow, that's great. I mean, I had a good foundation with the papers with Bill. I wrote a lot of grants, got most of them. I was funded. In short order, I was able to show that thrombospondin was made by mammalian cells. It was not only a platelet product, but made by like fibroblasts and endothelial cells, where it played an adhesive role. And there wasn't just one thrombospondin. While I was in Ann Arbor, we cloned thrombospondin 2 and thrombospondin 3. It was a family, and that garnered more grant support. Things were going well. I would go to the Gordon conferences. The field at that time was possessed with the identification and cloning of integrins. That's where a lot of the excitement was. And I was, Ann Arbor at that time was quite exciting. This is 86 or so. Bill Kelly had recruited a great cadre of young researchers, Francis Collins, Craig Thompson, Jim Wilson, Gary and Betsy Nabel, Jeff Leiden, John Lau, the list goes on and on. And I think these people sort of set a standard. They were doing really, really incredible work. And in a sense, they sort of threw down the gauntlet and said, this is the sort of work one should be doing. And I looked at my own work, which was good. I was funded, right? And I had 2 or 3 NIH grants at that time, I think, on it. But then I realized, I wasn't really breaking new territory, right? It was good work, but it wasn't sort of work you'd read about in an introductory textbook of biology. It didn't have that. And I said, well, this is a great opportunity. I'm funded. I always have had this childlike desire to be an explorer. Maybe I should think about doing something else. And so that's the sort of turning point.
Yeah. So how did you fixate on moving into the world of cell death and apoptosis?
When I look back on it, it was a very foolhardy decision. But I was first thinking of everybody at that time, and now we're in the late 80s, early 90s, was possessed by the cell cycle. The journal was filled with cell cycles. Everything was the cell cycle. But I was aware, being a pathologist, of the work of Andrew Wiley and John Kerr, who had described a form of cell death, apoptosis in tissues. And I thought to myself, this is interesting, and it would be great if it was amenable to a biochemical analysis, but that's a fool's errand, because this happens in tissues and you can't isolate those cells. What you really need is a cell culture system where you can induce apoptosis in a programmed manner, and then you can study the downstream event. So that sort of thought was percolating in my mind. And I was just, after I finished the day's work in the lab, before going home, I would stop by the library. This is before internet and everything else, and I would read the journals. And I was really struck that there was a paper by Yonihara in Journal of Experimental Medicine and a paper by Peter Kramer in Science, where they described antibodies to what we now know as the FAS or CD95 receptor. And these antibodies, lo and behold, they claimed could induce cell death in culture. And I thought, oh my God, here is the system I've been looking for. And I wrote to Yonihara. He sent me the agonist antibody. The receptor, meanwhile, had been cloned by Shige Nagata, and shown to have homology to the TNF receptor. That had been characterized by Dave Goodell and colleagues. And there was the realization that in certain cell systems, engagement of the TNF receptor by TNF could also lead to apoptosis. So here were these two receptors, the FAS receptor and the TNF receptor, that in culture could lead to apoptosis. So I wrote to Genentech and I got recombinant TNF from them. And then I had a really gifted MD PhD student join the lab, Munish Tiwari. And I said, hey, Munish, get this. Let's work on what's downstream of these receptors. We'll call them death receptors. Nothing's known. I wrote to these guys. I've got the reagents, and Munish set up the system. He found an MCF7 variant cell line that was very sensitive to either the agonist antibody or TNF. And when he would add these reagents, holy smokes, right in front of us, there would be this dance of death. The nucleus would condense, the cytoplasm would come to a boil, the membrane would would disintegrate into membrane-filled vesicles. I was like, wow, we're engaging a receptor and we're getting this dance of death. What's the signaling pathway? I said, Munish, listen, when we treat with these agents, all the cells die. So let's do this. Let's take an unbiased approach, what I'll refer to as the Sigma catalog approach. And let us just take kinase inhibitors, phosphatase inhibitors, you name it, and throw it on these cells. And what we are looking for is positive selection. So we're looking for cells to live in this ocean of death. And if we find such a compound, maybe that'll illuminate the downstream pathway. I was like, wow. He said, yeah. And 1 year went by. 2 years went by. We were most of the way through the Sigma catalog. Nothing. Marginal. But, unbeknownst to us at that time was work going on in disparate fields that culminated to give us a hint about what to do. And that was work going on in a field of IL-1 processing. This is work by Nancy Thornberry and Roy Black. So IL-1 beta and IL-18 are made in the proform to get the active cytokine. They need to be proteolytically processed. And they were after the protease because they thought, if we identify the protease and we can inhibit the protease, we can inhibit the emergence of these active cytokines. And they called this protease ICE for interleukin-1 converting enzyme, and they identified it. It was a cysteine protease, and they noted it had a very unusual substrate specificity. It cleaved after an aspartic acid residue. So you're probably saying to yourself, what does this have to do with cell death? Now, unbeknownst to Roy Black and Nancy Thornberry, Bob Horowitz's lab at MIT had cloned and identified the centrally important death gene in C. elegans in the worm, known as SED3. And they had no idea what it did. And one day they ran it through the database. And by God, it had homology to interleukin-1 converting enzyme. So SED3 turned out to be a protease. So we were following this literature, and I said, hey, Munish, what if these death receptors are engaging in ice-like protease, ice or an ice-like protease? Maybe that's how this dance of death is initiated. And he said, you know what? There's an inhibitor. There's this pox virus gene, CREME. It's a serpin, but it inhibits ice-like proteases. And why don't you write to David Pickup and Guy Salveson at Duke University and get it? And so I did. We got an expression construct. Munish expressed it that day. In the evening, we saw the results. And we couldn't believe our eyes. Cells that had formerly died, promptly died in the presence of TNF or agonist antibody, were now happily growing when they expressed CREME. So we had completely, totally nullified the death signal. No question about it. So we knew then that downstream of the death receptor was an ice or an ice-like protease. And then further work that Munish did in collaboration now with Guy Salveson, because we had CREME as a tool to fish out the mammalian death protease, the mammalian deathase. It turned out to be a ice-like protease that Munish called Yama after the Hindu god of death, but now known as caspase 3. So caspase 3 came from his original work on thinking about death receptor signaling. So that's how that evolved. And of course, once we found caspase 3, which is downstream, now that we had another major problem, which was like, how does the receptor, which the work of Goodell and Nagata had shown possesses no enzymatic activity, how does it activate caspase 3? How does it activate Yama? And for this, I was very fortunate. I had another very gifted MD PhD student join the lab, Arul Chennaiyan, and a postdoc, Marta Muzio, and they quickly unraveled this question. So, receptors at that time were thought to work by either functioning as ion channels or by altering phosphorylation, dephosphorylation events. They discovered, however, that death receptors were neither ion channels nor altered phosphorylation, dephosphorylation events, but actually assembled a signaling complex that we dubbed the DISC, or death-inducing signaling complex, that recruited and initiating ice-like protease, now known as caspase 8, that was activated by a mechanism that Guy Salveson and I call the induced proximity model, that allowed the generation of an active protease as the second messenger. So these were heady days, and it was an exciting time. So
I'm sitting here listening to you, and you're clearly so excited about all of this. And I wish we had time to go through all of the other things that you found after that. But you're on this absolute high, the scientific Shangri-La. You're finding all of this stuff. You're plucking what sounds like should be low-hanging fruit, but was very sophisticated to get there. So what in the world made you want to leave that kind of an environment and that world to go to Genentech?
I have a habit of throwing caution to the winds when it comes to science, and also when it comes to my own career. And my brother was a rheumatologist in private practice in the Bay Area. And I got a call from a headhunter, said, there's a position, director of oncology at Genentech. Would you like to look at it? And I thought, well, I'll go over, have dinner with my brother, spend the weekend. And I'm a dyed-in-the-wool academic. This work is going gangbusters like there's no tomorrow. But when I came and I interviewed, I was very impressed. The CEO at that time was Art Levinson. The chief medical officer was Sue Hellman. And they were really committed to cancer therapeutics. They were really committed to basic discovery. And remember, Genentech had a history in basic discovery. And I knew Dave Goodell pretty well, and I called him. He had, by this time, left Genentech. He'd started a company, Tularic, and he really encouraged me. He said, this is a sort of place you could have your cake and eat it too. If you're interested in the development of therapeutics and you're interested in, furthering your own research, it's a very unique environment. And so I thought about it, and I went back to Ann Arbor. And what dawned on me was that if I didn't take this position, an equivalent position may not come around. It wasn't like a chairmanship. You don't go to University X, then University Y will ask you a few years down the line. It was like, this was a very unique situation. And I really trusted Dave Goodell. I remember I even called Craig Thompson, who's a good friend, and I said, Craig, what do you think of this position? He said, take it. It's a very unique environment. And people often ask me, what's it like to be in industry? And I say tongue in cheek that, I haven't the foggiest because I work at Genentech. I don't work in industry. It's because it is such a unique environment. It's a very grassroots up place. The department I had I recruited Napoleon Ferrara from cardiovascular, Mark Slakowski, who did the HER2 therapeutics, Fred DeSavage, who worked on the sonic hedgehog pathway, Avi Ashkenazi, who worked on apoptosis. So I was able to recruit a lot of very good people from within the company and from without. I recruited Paul Polakis for Wind Pathway. So we had a really good cadre of investigators. And the sort of ethos in the department was that, if you do good basic research and you unveil fundamentally important components, then drug discovery will follow.
If you could not have been a physician or a scientist, what do you think might have kept you so motivated over all of these years? Is it politics, like we were talking about before, and public health?
I think politics would have been attractive, but the reality of politics is it often comes down to the color of your skin and your religion, and that can be a tall order. Ironically, a lot of the very successful politicians in the Conservative Party in the United Kingdom have an East African background. So I think there is a possibility. I think I would have always wanted to be an explorer, and going back to the tomb of Tutankhamun and Hammurabi's Code and those sorts of readings. I would have been maybe an Egyptologist, discovering something new, or maybe coming from the home of Leakeys who were from Kenya, being an archaeologist, a paleontologist, discovering, maybe that's science. But yeah, I think new knowledge is what really attracts me. I think that's why I loved clinical medicine, but I sort of found it algorithmic, and I found that many people could do it very well and often better than I. Experience really mattered. You were better at doing an appendectomy if you had done 100 of them versus one of them. And, so I just gravitated towards new knowledge.
Well, in that vein, it's fascinating. You crave the new, and yet you study the dying.
Wonderful.
All right. Well, thank you so much for joining me today, Vishva. It's been an absolute honor and a real treat to hear more about you.